Hi everyone, I'm Russ Knapp, owner of Comfort Keepers. We are so proud to be a longtime sponsor of Petoskey Chamber's Hot Topics series. The series is dedicated to bringing education and awareness to important community issues. I hope you're having a wonderful summer here in Northern Michigan with spending time with friends and family. Speaking of family, if you have a loved one who needs additional help, Comfort Keepers help seniors thrive while living independently in their own home. I hope you enjoyed today's hot topic, brought to you by one of the greatest chambers around, Petoskey Area Chamber of Commerce. Thank you.
Welcome to another Petoskey Strong Hot Topics Focus on Health. I'm Nikki Devitt, president of the Petoskey Regional Chamber of Commerce, and I am joined once again by Dr. Karen DenBesten, the Infectious Disease Specialist for McLaren Northern Michigan. Hi, Dr. DenBesten. Thank you for taking time with me today.
Yeah, thanks, Nikki. Thanks for having me here to talk about COVID.
We've done this for many months, and I think it's really important now to mark where we are. We're early into the month of August in 2021 for anybody who goes back and watches these in the future, just to see what it was like. And everybody's heard of Delta. Everybody knows that CDC now has guidelines that are, if you are vaccinated or unvaccinated and you're indoors, and we're telling our businesses this, it's time to go back to masks. How is this affecting us locally with this next surge where we're at? How is the hospital faring right now?
Yeah, I'm sure everybody's heard about the Delta strain now. What this is, Delta is a variant of COVID-19. This is what viruses do. They mutate. This is not unexpected that this would happen, but it's mutated in such a way that it's extremely contagious and potentially more deadly than the variants that we've been used to. The good news is the immunization is very effective in preventing people getting sick, even with the Delta variant. So immunizations and mitigation measures are very effective in preventing people from getting sick and preventing the spread of the Delta variant of COVID. But we have gotten to the point, people have seen in the news what's happening in other parts of the country with hospitals becoming overwhelmed and just Delta spreading like wildfire. And it's coming to Michigan now, and it's here. We're seeing increased numbers in our community in Northwest Michigan and in Emmett County of COVID. We're back up to numbers, not like we were in the fall or in the spring, but we are seeing increasing numbers of patients hospitalized with COVID-19 now. This on top of the fact that we do have the hospital is at capacity with other patients as well who have other medical needs that are critically ill. We're having a difficult time with staffing and room and availability to house these patients. So it's really putting a strain on our resources here in Northern Michigan.
And that was something that, we talked about very early on with COVID. And I remember this conversation in April of last year. And what happens, and it's not necessarily just the COVID patients that stress our hospitals and our healthcare workers. It's that it's not as if everything else just stops because there's COVID. You have accidents, you have people who get sick, you have people who need, medical attention in a variety of ways. And when your healthcare system is strained and stressed to that level, it becomes even harder for everyone to be cared for and taken care of. And in addition to that, with staffing shortages, to have the ability to care for those people. So this is one of those, quote, side effects of COVID that I think we remember hearing about a long time ago, what feels like years ago, and in a way was. And now, once again, it's back up, but it's just a little further from everybody's mind. And we hope that people understand that, we're back to doing things that we can do to help our healthcare workers and to help our community and keep our businesses safe and everybody functioning. And those are those simple tactics we have known and used from the get-go.
Yeah, we're a year and a half into this, and we're doing our best to care for all patients. Other patients' healthcare needs don't stop when COVID hits. It's been kind of the sad reality of COVID too, that I think patients have been putting off routine medical care, and we're seeing patients coming in sicker and sicker because routine medical care has been put off because of COVID. We need to maintain the capacity to care for all patients, COVID and non-COVID. But as is happening across the country, it's not just here. We're seeing major staffing shortages. People are getting burned out. They're leaving the medical profession. It's really quite difficult to maintain this stamina. And the level of care we need to, a year and a half into it. People need to do everything they can to prevent the spread, to just ease the burden on the healthcare professionals and for their own safety as well when they have medical needs that arise and need to come to the hospital.
And that comes back to wearing masks, social distancing in large groups indoors, washing your hands, and getting your vaccine. And we have an incredible statistic for Emmett County that I'm very proud of, and that is our vaccination numbers are very high in Emmett County. And that is something to be proud of. But we have an influx of people that come and visit us, and we know this from all over the state, the country, and beyond. And really making sure that we continue to have that vaccinated population is a key to helping our businesses stay open as well. We had businesses just last week, 2 businesses that had to close, temporarily due to COVID, and because employees, had gotten sick, and that they're shorthanded as it is. So, it can affect so much, and it can do so much good. And we have you can really walk anywhere right now and to any clinic, any pop-up clinic, or into pharmacy, Walmart, Meijer, and get a vaccine. So they're readily available.
The vaccines are free, and they're very effective, and they're safe, and they prevent you getting seriously ill from COVID and potentially prevent transmission and severe illness from COVID. The patients we're seeing in the hospital are not the vaccinated patients. It's true that there can be breakthrough cases, but I think that the media really kind of sensationalizes those, is the unvaccinated patients that are getting really very sick and ill. And we also need to keep in mind that children 12 and under have not had the opportunity to get immunized. We are putting children at risk by not getting immunized ourselves and not taking proper mitigation measures that we know work. At this point, everybody knows how it's spread. Everybody knows how to prevent it. Get immunized, wear your mask, make smart choices. If we don't do this, we're putting our children 12 and under at risk. And I think people think that kids don't get seriously ill from COVID, and that's not true. Across the country, we're seeing pediatric intensive care units fill up with children becoming seriously ill, requiring intubation, and yes, even deaths in children. This is a tragedy. We don't have a pediatric intensive care unit here at Northern Michigan Hospital. When the children get sick, and it will happen, they're going to be life flighted down to a medical center that has a pediatric intensive care unit, if there's even availability. This can all be prevented by getting as many people immunized, wearing masks, and making smart choices. I'm very hopeful that as we go into the fall and into the winter, that there will be approval for immunizations for the children. That's what we really need. But the more people that get immunized, the better we're going to fare and weather this wave, this COVID tsunami that's coming through. I am confident that we do have good immunization rates in Emmett County, but we do pull from surrounding counties that don't have as high of an immunization rate.
Right. And it puts more strain back on the hospital from that standpoint. And to your point too, Dr. DenBesten, before I'll let you go, we have been down this road before. You and I have had this conversation before about getting out from underneath the crushing weight of what it can do when we have a case spike, and how that affects not just our hospital, but our community as a whole. So we've been here, we've done this, and we've gotten past it before. And so it doesn't mean that this is doom, gloom, and awful. What it means is that we just need to remember we know how to do this and what's best for our community and what's best for our businesses and our healthcare workers and our, complete and total. We want to keep that economy churning too. So while there may not be mandates that are state or federal, there's great guidance from CDC, from OSHA, and taking that guidance into heart is really important right now for our community.
Absolutely. We can do this. We've done it before. Like you said, it's not all, gloom and doom. We know the path forward. We know the way out of this. We need to make smart choices and do everything. It's everybody's responsibility. It's not just local businesses. It's not just healthcare workers. Everybody's responsibility to do everything in their power to stop the spread of COVID. And we know what to do at this point.
That's the perfect way to end on it. Thank you so much, Dr. DenBesten. We'll check in again in a few weeks or so. Maybe this time we can extend it a little longer. I like it. I like talking, but I like when we can extend it a little bit longer. So thank you. Thank you very much.
Thank you.